Welcome to Project First Line, environmental cleaning and disinfection for emergency medical services. Potential exposures in the field. EMS providers are at higher risk of exposure to a variety of pathogens. Exposure to potentially infectious body fluids, airborne particles, and droplets puts you at risk for various pathogens such as hepatitis B and C, HIV, tuberculosis, influenza, and SARS-CoV-2, the virus that causes COVID-19. This is not an exhaustive list, but shows just some of the potentially life-threatening diseases that are encountered by EMS providers. It's important to point out that rabies is transmitted by an infected animal, most commonly through bites, and is also a potentially life-threatening disease to which emergency response personnel may be exposed to. While our conversation today focuses on human-to-human transmission, it's important to also consider potential exposure to animals as well when providing care in the field. The places where germs lived are called reservoirs. There are reservoirs in the human body and in the environment. In the human body, we have the skin, the gastrointestinal system, the respiratory system, and blood. In the healthcare environment, we have water and wet surfaces, dry surfaces, dirt and dust, and devices. When you understand where germs are found and how they can be moved to places where they can cause harm, you can recognize when they can be spread and decide what you can do to protect yourself and your patients. Let's move on and take a closer look at the environmental reservoirs. Reservoirs in the environment. We're all aware that germs are part of everyday life. The world is covered in germs, especially out in the field where you provide care. When we think about where germs live in the healthcare environment and the steps that we can take to keep germs from spreading, we think of the four core reservoirs: water and wet surfaces, dry surfaces, dirt and dust, and devices. We want to pay special attention to dry surfaces and medical devices and equipment in the EMS environment, as they can act as hidden reservoirs for harmful pathogens, allowing germs to persist and spread between patient and providers. Of course, these are not the only places where you can find germs, but we'll focus on them for our discussion about environmental cleaning because they are common sources of spread. Listed here are just a few germs that are commonly found on these different surfaces. Some germs are resilient and can survive on surfaces for a very long time. For example, C. diff spores have a protective coating allowing them to survive for months or sometimes years on dry surfaces. Rotavirus, which is a very contagious virus that causes diarrhea, can survive for approximately 2 months. Viruses from the respiratory tract, such as influenza, rhinovirus, and SARS, can survive on surfaces for a few days. It's easy for EMS providers and patients to come into contact with these harmful germs. Regular cleaning and disinfecting of frequently touched surfaces are essential to minimize the spread and maintain a hygienic environment. In most cases, there are four main pathways for germs to spread from a reservoir in healthcare. The first is through touch. That usually involves the skin, especially the hands, but it also happens with devices and equipment, which touch different people and surfaces. Another pathway for germs is through breathing in. A third is through splashes or sprays of blood, body fluid, or water from a sink or other source. Germs in those splashes or sprays can get into a person's eyes, nose, or mouth, or into a cut or a break in their skin and cause infection. The last common pathway for germ spread in healthcare is through clinical care tests that bypass or break down the body's natural defenses, like when a patient's skin has to be broken to insert an IV. That creates a pathway for germs to enter the patient's body. Knowing where germs live and how they spread helps you recognize risk. Infection control actions at any one of the points we just discussed can stop germs from spreading and causing infection. To make decisions about infection control, it's important to think about where the germs are, which reservoir or reservoirs you are dealing with, and how the germs might get somewhere else, which is the pathway. Then, you can recognize the risk for germ spread to happen and do something about it. Looking at this example of how we can recognize risks, We start with the reservoir, which is blood from an injured patient. A patient's blood can be found on the surrounding environment, on dry surfaces, and medical devices and equipment, such as a stretcher. We know the blood poses an infection risk if touched, so we make sure to put on gloves to protect ourselves from exposure. By recognizing the infection risk, we can take the necessary infection control actions, such as the cleaning and disinfection of surfaces and equipment, which we'll discuss in greater detail. Let's now talk about environmental cleaning and disinfection as it relates to the pre-hospital setting. Now that we have a better understanding of where germs can be found, let's talk about cleaning, disinfection, and sterilization. We'll begin with cleaning. The goal of a cleaning is to remove visible dirt, dust, grime, smears, and spills from surfaces and items. When we clean, we remove some germs, but not all, with the use of water with detergent or enzymatic products. Cleaning is a critical step that must be performed before disinfection or sterilization. Next, we have disinfection. Through the use of chemical disinfectants, disinfection kills most germs on surfaces and objects. There are 3 levels to disinfection, which are low, intermediate, and high-level disinfection. We'll go into more detail about each level of disinfection later in this presentation. Next is sterilization. The purpose of sterilization is to completely eliminate all microorganisms. Sterilization includes methods that prove to kill all microorganisms and is done using specialized processes and equipment. This is generally achieved by a sterile processing department. For the purpose of this presentation, we'll focus on cleaning and disinfection. Let's move on and take a closer look at each category. Cleaning and disinfection products. When it comes to environmental cleaning and disinfection, it's important to understand the difference between cleaners and disinfectants. Let's start with cleaners. Cleaners such as soap and water, detergents, and enzymatic cleaners remove dirt, organic matter, and some germs from surfaces, but do not necessarily kill them. Disinfectants, on the other hand, are chemical products designed to kill or inactivate germs on surfaces. Cleaners and disinfectants can be wipes, sprays, or solutions that may require dilution. Some products are both cleaners and disinfectants, meaning they can clean and disinfect in one step when used correctly. Always read the label to understand how to use the product. It's important to note that some disinfectants are strong enough to kill bacterial spores. Bacterial spores are a harmful, tough form of bacteria that can survive for a very long time on surfaces and are very difficult to kill. A common instance of bacterial spores in the healthcare setting is C. difficile, or C. diff. These spores can only be killed with strong disinfectants. It's important to always check the disinfectant label to ensure that the product you're using is effective against the germs that you are dealing with, such as C. diff. The cleaning and disinfectant agents listed are just a few examples and not an exhaustive list. Selecting cleaning and disinfection products. Here we have important information to take into consideration when selecting a product. This includes compatibility with surfaces and equipment. Ensure that the product is safe to use on the type of surface or equipment that you are applying it to. Remember to check the product's instructions for use to prevent damage. Pathogen effectiveness. Always make sure you use an EPA-registered disinfectant. The EPA regulates disinfectants for use in healthcare settings and ensures that the disinfectant is effective against the pathogen you are trying to eliminate. Contact time. A very important piece of information to look out for is the contact time, which can also be called dwell time. The contact time means the amount of time that a disinfectant needs to stay wet on a surface for it to work properly. When you apply a disinfectant, it needs a little while to effectively kill the germs. As an example, if you're using a product that notes a contact time of 5 minutes, then the surface that the disinfectant has been applied to must remain wet for those 5 minutes in order for it to work. If you wipe away the solution too soon, or if you fan or blow on it to make it dry faster, the product will not work well enough to get rid of the germs. Be aware that some products list multiple contact times based on the pathogen targeted. It's important to follow the product's instructions and recommended contact time to make sure surfaces are thoroughly disinfected. One-step versus two-step products. A one-step product combines cleaning and disinfection in a single application. A two-step product requires two applications. One, to clean the surface or item by removing visible dirt and debris and organic matter. The second application disinfects. Remember to review the product's label for proper usage instructions. Last is storage and safety. Ensure that the product is stored in a well-ventilated area and away from direct sunlight. Follow PPE requirements and ventilation guidelines, and review the first aid information in the event that the product is swallowed, inhaled, or absorbed through the skin. Let's now review the different levels of disinfectants. Starting with high-level disinfectants. High-level disinfectants completely eliminates all microorganisms except for small numbers of bacterial spores. High-level disinfectants should be used on objects that make contact with mucous membranes or non-intact skin. For example, endoscopes. Next are intermediate-level disinfectants. Intermediate-level disinfectants kill vegetative bacteria, most viruses, and most fungi, but do not reliably kill bacterial spores. Most notably, products in this category have a tuberculocidal claim, meaning they are potent enough to kill bacteria like tuberculosis. This level of disinfectant is used on non-critical surfaces and objects that may come into contact with non-intact skin or mucous membranes that require a higher level of disinfection but not sterilization. Next are low-level disinfectants. Low-level disinfectants kill most vegetative bacteria, some viruses, and some fungi, but they cannot be relied on to kill mycobacteria or bacterial spores. A low-level disinfectant should be used on objects that come in contact with skin and not the mucous membrane. A low-level disinfectant can be applied to environmental surfaces and patient equipment such as blood pressure cuffs, pulse oximeters, and bedpans. Low and high-level disinfectants can be identified by the active ingredients that are found in the product. While you may not need to be familiar with the chemicals, it is important to understand the differences between the two levels of disinfectants and what the product can be safely used on. It's recommended that you follow your agency's guidelines when selecting a disinfectant, and, as always, read the product's label. Effective cleaning and disinfection require more than just using the right products. They depend on the following best practices to ensure surfaces and equipment are properly cleaned and disinfected. This section will cover key steps to maximizing infection control. Surface cleaning workflow. It's important for us to follow a workflow when cleaning and disinfecting surfaces because it ensures that we are effectively and efficiently removing germs from surfaces in a safe manner. Here, we have general best practices for surface cleaning. We'll discuss how to clean and disinfect medical devices and equipment later in this presentation. We achieve surface cleaning by moving from cleaner to dirtier surfaces to avoid spreading dirt and germs to other surfaces and items. Then, we proceed from high to low, or top to bottom, to make sure that dirt and germs do not drip or fall from elevated surfaces to the already cleaned areas that are below. Last, we make sure to clean in a systematic manner, which simply means working left to right or right to left and keeping in that direction. Following these workflow principles provides a methodical approach to cleaning, which helps reduce the risk of cross-contamination. General disinfection procedures. It's important that cleaning and disinfection be done as soon as practical. Place contaminated equipment in a leak-proof bag and keep it separate from clean equipment. Remember, wear gloves when cleaning equipment and when using disinfectants to protect the skin from damage and contamination. Thoroughly clean equipment with soap and water to remove organic matter before disinfection. And ensure that disinfected items are properly stored to prevent reinfection or contamination during storage. The last step is to perform hand hygiene, even if gloves were worn. Remember, always follow your agency's policies and procedures when performing a disinfection. Different situations call for different levels of cleaning and disinfection in order to effectively reduce the risk of infection. This next section will cover strategies based on precaution levels, ensuring that surfaces and equipment are properly managed to prevent the spread of harmful germs. Understanding standard and transmission-based cleaning and disinfection. Cleaning and disinfection strategies must align with the different levels of precautions in order to prevent the spread of germs. Whether following standard precautions for routine care, contact precautions, or any time you are dealing with special pathogens, selecting the right approach ensures that surfaces and equipment do not contribute to transmission. Here's an overview of the different precautions levels. First, we have standard precautions, which includes cleaning and disinfection, and the use of PPE to prevent the spread of germs, which protects then both patients and healthcare workers. Next are transmission-based precautions. This includes contact, droplet, and airborne precautions. These types of precautions will guide the selection of PPE, cleaning and disinfection, and decontamination procedures. Last, we have special pathogens precautions, which have strict cleaning and disinfection protocols for highly contagious diseases. Viral hemorrhagic fevers and severe respiratory diseases fall in this category. Let's now take a closer look at the cleaning and disinfection processes. Effective cleaning and disinfection. Whenever you follow standard, droplet, and airborne precautions, routine cleaning and disinfection of surfaces and equipment play an important role in preventing the spread of germs in all patient encounters. Remember, select a disinfectant effective against the target pathogen. Always check the product label for efficacy claims and the required contact time. First, clean and disinfect visibly soiled surfaces with an EPA-registered disinfectant, following the product label instructions for use. Next, disinfect all high-touch surfaces, including the stretcher or potentially contaminated surfaces, with the disinfectant. Last, disinfect patient equipment between each use with the disinfectant. While standard precautions involve routine cleaning and disinfection to remove or kill most pathogens, it's important to note that contact precautions require more intensive cleaning and disinfection of high-touch surfaces and equipment, especially when dealing with pathogens that can persist on surfaces for extended periods of time, which may require the use of stronger or high-level disinfectants. Special pathogens precautions. Special pathogens, which include viral hemorrhagic fevers such as Ebola, Marburg, and yellow fever, are highly infectious, contagious, and can be fatal. They can affect many organ systems of the body, damage the overall cardiovascular system, and reduce the body's ability to function on its own. While viral hemorrhagic fevers are rare in the US, it is essential that personnel are trained and follow strict precautions to prevent transmission and contamination. Cleaning and disinfection of equipment after transport for special pathogens should be done in collaboration with state and local public health officials. This is because special pathogens may generate Class A medical waste, which requires special handling and processing. Special pathogens also trigger a public health response and investigation. There are federal and state guidelines and regulations that must be followed. Let's explore the best practices for properly cleaning and disinfecting various types of medical devices and equipment. Cleaning and disinfection of medical devices and equipment. Let's now take a closer look at how medical devices and patient care items are classified based on the intended use and potential risk of infection involved in their use. This classification helps guide us in determining the appropriate level of disinfection or sterilization needed for different types of items used in the field. The three main categories are non-critical, semi-critical, and critical items, which we'll discuss in further detail on the following slides. Cleaning is an essential step before disinfection or sterilization. Policies should specify if disinfection, high-level disinfection, or sterilization is needed based on the device's intended use. Some instructions for use may specify high-level disinfection or sterilization based on the use. Single-use and disposable items should be disposed of properly. Never save or reuse these types of items. PPE must be used whenever there is a potential for exposure to body fluids or potentially infectious materials during cleaning and disinfection. The type of PPE and supplies required depends on the item's classification and the cleaning method needed per the IFU. High-level disinfection also requires a dedicated area in a controlled environment in order to minimize the risk of cross-contamination and to ensure the safety of the personnel. Remember, gloves are needed to prevent skin contact with chemicals. And, as always, follow the IFU for both the item and the disinfectant. Cleaning and disinfection of non-critical medical devices and equipment. Non-critical items are those that only come into contact with intact skin or do not directly touch the patient. While they carry the lowest risk of transmission, they will still need to be cleaned and disinfected appropriately. Examples include stretchers, blood pressure cuffs, splints, backboards, and stethoscopes. To clean and disinfect, first, manually clean the item to remove any visible soil such as dirt, blood, or body fluids. Then, disinfect the device or item with an EPA-registered disinfectant. Disinfectants can come in the form of impregnated wipes or spray. Follow workflow principles and ensure that all surfaces are covered with a disinfectant and remains wet until the dwell time is met. Then, allow equipment to air dry completely before storing or placing them back in service. Remember, do not attempt to dry an item faster. Cleaning and disinfection of semi-critical medical devices and equipment. Semi-critical items come into contact with mucous membranes and non-intact skin. Semi-critical items minimally require high-level disinfection using chemical disinfectants. This level of disinfection is not typically performed on site. Instead, reusable items are often sent to a hospital or a third party as specialized training, equipment, detergents, ventilation, and PPE are required. If performed in-house, ensure that proper training has been completed and follow policies and procedures. Cleaning and disinfection of critical medical devices and equipment. Critical items come into direct contact with sterile tissues or the bloodstream. Since contamination of these items could lead to a serious infection for patients, they must be sterile before use. Examples include scalpels and forceps, to name a few. Sterilization of such items is generally not done on site. Reusable critical items are sent to a hospital sterile processing department or to a third party for sterilization. This is because the sterilization process requires specialized training, supplies, and a controlled environment designed solely for sterilization of medical devices. This area is equipped with specialized equipment necessary to ensure devices are thoroughly sterilized for reuse. It also means that the space is designed to prevent contamination and is separate from other areas to maintain a high standard of infection control. Decontamination of the emergency apparatus. The exterior and interior surfaces of emergency vehicles, especially high-touch areas that are commonly handled by EMS providers, should be disinfected between calls and at the end of a shift. Cleaning and disinfection should be performed at the receiving medical facility when possible to prevent cross-contamination. For your safety, gloves and eye protection should be worn when cleaning a transport vehicle. First, remove visible contaminants, including trash and single-use items. This is an important step to prevent cross-contamination. Ensure that waste is disposed of in the appropriate receptacle. Separate reusable instruments and secure those requiring high-level disinfection or sterilization. Next, disinfect interior and exterior surfaces, including those that are potentially contaminated, and high-touch surfaces with an EPA-registered disinfectant. Apply the disinfectant to reusable, non-critical equipment such as the stretcher. Maintain a cleaning workflow and allow equipment and surfaces to air dry. Following disinfection and once surfaces have dried, prepare the vehicle for the next patient. Remember, to prevent contamination, it's important that the driver's compartment be maintained as a clean zone, meaning gloves or other PPE used during patient care should be removed prior to entering the cab. Let's take a look at some of the cleaning and disinfection do's and don'ts. Do wear PPE when performing cleaning and disinfection tasks. Gloves should always be worn. Additional PPE is dependent on the cleaning and disinfection solution instructions for use. Do ensure that disinfectants are EPA approved for the pathogens you're targeting. Do follow workflow principles and allow for sufficient contact time for disinfectants to work effectively. And do perform hand hygiene before and after all cleaning and disinfection tasks. Hand hygiene is always performed before and after glove use. Moving to the don'ts. Don't skip cleaning before disinfecting. Dirt and debris can reduce the effectiveness of disinfectants. Don't neglect the cab areas. Both patient and driver compartments should be disinfected. Don't use the same cloth or wipe for multiple surfaces and equipment to avoid cross-contamination. Medical waste. Proper handling and disposal of medical waste are essential to maintaining a clean and safe environment in EMS settings. Understanding how waste management connects to cleaning and disinfection helps prevent cross-contamination and protects both providers and patients. Here is an overview of ordinary and regulated medical waste. Let's start with the first column, ordinary waste. Ordinary waste is defined as lightly to moderately contaminated wastes that are not capable of releasing liquid or caked on blood or body fluids. Some examples include lightly to moderately used personal protective equipment, items that contain saliva, sweat, tears, or any contain urine, vomitus, or feces. These items are to be disposed of in a trash bin. In the next column, we have regulated medical waste. Regulated medical waste and special pathogen wastes are regulated by multiple agencies, such as the U.S. Department of Transportation and Homeland Security. States also have their own regulations. Regulated medical waste includes items that are capable of releasing liquid or semi-liquid blood, caked on blood, body fluids, or other potentially infectious materials. To understand what falls under this category, we need to think of containment. If an item is soaked with blood and drips onto surfaces when picked up, it poses a risk to you and to others, meaning we need to safely handle and dispose of the item. If an item is so drenched with blood or body fluids that pools of liquid are left behind, then it goes into a biohazard bin since we do not want splashes or sprays to occur. Objects such as needles, lancets, scalpels, and broken glass should be disposed of in a sharps container to prevent injury and exposure. Category A infectious waste is a classification of waste that is capable of causing permanent disability or life-threatening or fatal disease in otherwise healthy humans upon exposure to the substance. Category A waste includes solid medical waste containing pathogens from highly virulent agents, such as those causing Ebola, smallpox, and other viral hemorrhagic fevers. Category A waste from the transport of a patient with suspected or confirmed highly infectious disease will need to be disposed of according to local, state, and federal regulations. A full list of Category A waste substances can be found by following the CDC link in the footer of the slide. The takeaway is that a majority of medical waste can be disposed of in a standard or regular trash bin. Sharps and any waste that cannot be contained, and waste contaminated with a Category A substance, is disposed of in designated regulated medical waste bins. Here are the key takeaways. Cleaning and disinfecting surfaces and equipment are vital steps to removing harmful germs from the environment and helps to protect patients. Always follow the instructions for use for both the instrument and the disinfectant. Waste should be disposed of in a designated waste receptacle. And, as with any infection control action, follow your facility's policies and procedures. Additional information on topics discussed throughout this presentation can be found on the following web pages.